Hello. Hold on, I can't hear you.
Hello, can you hear me
Hi.
now?
Yes, I can hear you. Can you hear me?
I can hear you.
Thank you so much. I really appreciate your time.
Oh, my pleasure, my pleasure. How are you doing over there?
Doing well. Where are you located again?
Massachusetts.
That's right. That's
Yeah.
right. How's it going over there?
So I mean, we haven't closed. We've been open, but limited access type of thing. So we've been all right. We're waiting for our governor to make his decision if we're going to be able to, open the state. But he seems to be being very conservative about it. So kind of just
Same.
sitting on eggs, waiting for him to decide.
Same thing's happening here. It's mayhem.
It is. It's very crazy. It kind of puts things in perspectives and pushes up against all your beliefs at the same time.
I think so too.
Yeah. I've been
Yeah.
here in practice a long time, so it's kind of interesting to watch the process. I have friends who have just decided to retire because of this and have been in
Oh,
practice for
really?
50 years.
I
Yeah,
could see that being the push. How long have you been in practice for?
38 years.
That's amazing.
Yeah.
Congratulations. I
Yeah, my
can't.
daughter's with me now, so she's there. She's been with us for 5 years. So
That's incredible.
yeah, it's good. I mean,
Are you still teaching for the ICPA?
no,
I didn't
I
see your name. Okay.
about 2 years I retired from that because I wanted to do my own program. So I've been running my own. I mean, I taught my own programs with them. It just got too much traveling that much for me. I just got, at least once a month for them. And then my other person, I was doing like 20 plus weekends a month out plus
Oof,
practicing. Yeah, it
that's
got a
too
little
much.
old.
No, I agree. That's too much.
But I loved it. I mean, yeah, it was nothing, it was just, I wanted to teach some, the other thing with the ICPA program, which is an awesome program, but I have to teach the same thing over and over and over again there because it's fun. So, I think I was with them 14 years. So,
Wow.
I mean, I could pretty much just, leave my body and teach the seminar at that
Exactly.
point. So,
Just, yeah, default to autopilot and
yeah, but great people. I loved it. I still support them. And the guy who took over for me, I've known for years. He's an SOT craniopath as well. So I know they're in good hands. So it's good.
that's great.
Yeah.
Well, the reason I wanted to speak with you is because I have a mostly a pediatric practice. We have 5 doctors in our office, and we're kind of, everybody's got their niche, but it's mostly family practice. And I see mostly pregnant moms and babies. And
Cool.
I've been in practice 20 years.
Awesome.
And I'm noticing, and I don't know if you're noticing this too, but do you find that there's a bigger trend toward torticollis these days compared to say 20 years ago? Is it just that we're looking for it more, or is it
You
showing
know,
up more? Or,
it's interesting. So torticollis, flagiocephaly, brachycephaly, tongue tie. It just seems like it's pandemic's a bad word right
yes,
now. But
yes.
so I look back at my practice and look back. So I've always done pediatrics. It's always been part of my practice pretty much from the get-go. And I noticed that over periods of years, there have been things that people have brought their kids into chiropractic. So it was ear infections was a really big thing for one point. Asthma was another really big thing. Then, of course, autism became another thing. And now it's like this whole cranial facial distortion issue, including tongue tie, lip tie, buccal tie, flagiocephaly. So I think that the rise in head deformity came in the 90s, though, when the American Pediatric Association freaked people out about letting their kids lie on their stomach
Mm-hmm.
because they were going to die of SIDS. So that really added to the brachiocephaly. But the distortions I see now, I can't, are we looking better? Are we looking like I have found a number of patients, 20s, 40s, and 50s, who have actually been tongue-tied all their life.
Yes.
Like I remember Aaron was my daughter, who's Dr. Aaron. She had me look at this kid who came in to see her, and he was in his 20s, had TMJ problems, and she goes, "Daddy, he's talking weird." And she goes, "I think he's tongue-tied." He's been tongue-tied for 20 years. I had a 50-something-year-old woman who came in, who her mother, who was 80, referred her in because she's had TMJ problems all her life, and she was severely tongue-tied. No one ever said anything to her. I mean, I see this. So are we looking more? Yes. Is it more prevalent? It's hard to tell. I talked to a guy who is in 30 years of practice, a pediatric orthodontist, and his feeling was no, it's not more prevalent. that we're addressing it more and finding it more. So I think that, for example, posterior tongue ties
Mhm.
probably been around for ages. And I don't really think it, still in my opinion, they don't need to be cut most of the time. So that's the case. And as far as flagiocephaly and head things, I don't know. Because of being a craniopath for so long, that was always a big part of my cranial practice for kids. Like parents would see their, torticollis, head tilts, not turning to one side, eye tracking issues, stuff forward head postures, that kind of stuff. Even like teenagers creating bruxism. So I don't know if that percentage has changed as much. I think that the awareness of it has changed significantly. Just from, teaching for 38 years, there's a lot more chiropractors who are actually looking at the cranium and addressing it compared to when
Right.
I got out of school, no one ever looked at it.
Well, do you think that that comes from also an awareness of just the importance of it?
Well, that's the other thing. Research is coming out now talking about cerebral spinal fluid mechanics and
Right.
how important it is to actually diagnosing neurodevelopmental disorders through increased cerebral spinal fluid pressures. So yeah, the medical world, I have little air quotes here, have decided that cerebral spinal fluid is actually important and it works as a lymphatic system. They came up with this great aha moment in 2015, and I have quotes from 1972 talking about it. So yeah, so there's an awareness of it. I think though, craniosacrotherapy, for what Upledger did, is bring it to awareness. Regardless of the fact that he'll teach it or will be taught to anybody, he brought an awareness of what craniosacrotherapy is. So there's definitely more acceptability towards that process. And people are understanding it. So yeah, I think slowly but surely it's making some, lack of a better term, headway into the process.
Do you, being that most of the people who are going to see these little clips are going to be parents of children with torticollis,
Sure.
can you speak to how you feel about helmets?
Oh, sure. Um, okay, I thought you were going to hit me with the torticollis neurology, but helmets are this. So flagiocephaly or brachiocephaly is a condition in which the cranial bones are not growing equally. And the reason for that is often because of internal pressures, not external pressures. So there's a system called the meningeal system. I actually have my little head here, or a little baby, his head here, okay? So the meningeal system, since we're talking to parents, is basically a tube that attaches all the way to the tailbone, all the way up the spine, comes into the cranium, and then attaches into the cranial bones and comes out through these sutures in the skull and becomes actually a covering, what's called the periosteum of the cranium. So this tube attaches all the way down. If this tube is pulled too tightly in certain areas, what it does is it puts unequal pressure on the cranial bones. And that changes how they grow. So the dural system is similar to gravitational forces. In other words, if I took my hand and pressed on this head for 2 years over here, this bone would flatten. Okay, the dural system does that from inside. It pulls it and flattens it. So what's happening is the first year of life, the cranium or the brain will grow 101%. And it's going to grow. The reason this system is set up with these cracks or spaces is so that the head can expand twice the size. So when you have this underlying tension that's causing the bones to not move correctly, what happens is the brain will expand. So if I have too much tension in the back of the skull here, what's going to happen is the brain's going to continue to grow out this way. So what it's going to do is going to create a bulging here. It's going to maintain a flattening here. And that's basically what flagiocephaly is. One side is swollen here, and it's a measurement. What helmets do is they force the issue by putting pressure on the side that's bulging and leaving a space like this. They leave a space so that they can force the cranium to grow in the other direction. So the problem with it is they're not dealing with the underlying condition, which is the dural tension and the effect that has on the nervous system. So aesthetically, it changes. The best way I can describe it is there's two thoughts in the dental world when it comes to putting on braces. There's the aesthetics, which means making your teeth look pretty, and then there's a functional to making your bite right. So you could go to a dentist and have aesthetics done and your teeth will look better. And very often those people end up having trouble. Kids have trouble down the road, TMJ problems, clicking, popping, jaw issues, because the aesthetics and the function don't always go hand in hand.
Right.
I think the same thing happens with helmets. Two other things happen with helmets is that when you put a helmet on a kid's head, it forces their head forward. and that when they're sitting on things or leaning on things, they'll land. That forcing of the forward head posture affects the cervical spine. It puts unequal tension on it, and it also changes what's called the curve in the spine. So if this is your head, you're supposed to have a backward curve in your neck that's called a lordotic curve that develops as you start to hold your head up. Well, if you're putting a helmet and you put in a car seat or things in your head is pushed this way, it affects the changes in that lordotic curve. And what happens is that lordotic curve causes stretching in the spinal cord. And that stretching in the spinal cord causes improper nerve impulses, tension in the muscles, and changes growth patterns, because once that curve doesn't come in, you put your head in a different place, and that changes the whole biomechanics of how the kid walks, stands, and ambulates from the rest of their life. Basically, it changes what they call proprioceptive system, which is the system that tells the body where it is in space.
That's great. And the reason I wanted to ask about that was mostly because there seems to obviously be a major connection between torticollis and plagiocephaly, right? And so a lot of the patients that I've seen, a lot of the parents I work with, it seems to, do you think that it starts with the torticollis? What do you think comes first?
Okay, well, it depends. So when we teach and when we talk about it, we talk about there's different patterns in the spine and nervous system. They're either what we call ascending or descending. In other words, an ascending pattern starts from, let's say, the pelvis or the sacrum. So let's say that tailbone is torqued and it puts a torsion in that door. It puts a torque in that system. That is a pattern that's ascending. But it can also happen on top. One of the most traumatic things of the birth process, whether it be a normal birth, forceps, C-section delivery, is the amount of stress that's put on the upper cervical spine. So there's two things that happen with the torticollis. One of the strongest attachments to that dural system that we talked about is around C2, C3, or second and third cervical vertebrae. So the torsion that's occurred during the birth process can stretch or put pressure on that dural. The 40% of the rotation of your neck occurs from those first two vertebrae in your neck. So if that area gets stretched or torsioned or irritated or swollen or damaged in any shape or way, it's going to affect the rotational component of the neck. And because the tension down there is so tight around the dura where it attaches, it's going to reflex up into the cranium. So very often the birth trauma or the torticollis can cause the flagiocephaly or the unnormal. But in assisted births, forceps delivery, vacuum deliveries, very often the opposite happens, is there's a pull in the cranium so strongly that it affects the neck. There's one bone, I'm going to use my big skull for a minute. If you look in the middle here, there's a purple and a yellow. You see that? That's called the sphenoidasla. That is what they call a synchondrosis joint. It's the most movable joint in the cranium. It affects this yellow bone here, which this bone basically articulates or contacts every single other bone in the cranium, except for the nasal and lacrimal bones, which are in the nose and the eye area. But what happens is this can create a torsion or a distortion, and the focus of that distortion through the muscles that come around through the cranium into the neck focus at the second cervical vertebrae, which is where most of the torticollis come from, the first two vertebrae in the neck. So that is what we call a descending pattern from cranial trauma. So I would say the two main causes of it are either stress during the birth process or in the early childhood development when they either from a fall or bang where they can't turn their head, and that comes from the neck up. And then the other is actual trauma to the cranium. It doesn't have to be birth. It could be child falling. I had a little kid that was brought into me. Mom was walking down the stairs with her 4-month-old holding it with a nightgown and stepped on the edge of her nightgown and flung the kid down the stairs. That is direct cranial trauma. The kid came in with head trauma, and we addressed it so it didn't develop a descending pattern, but situations like kids falling off changing tables, having brothers or sisters that bang. So those kind of traumatic issues can create that dural stress pattern as well.
And it seems like the most common approach, or one of the most common approaches outside of maybe chiropractic offices, is to really just deal with it aesthetically, right? Whether we're dealing with helmets or torticollis collars or that sort of thing. What is your opinion?
Exercises. Exercises.
Yes, exactly. Just stretching the SCM muscle, or even cutting it, or And so, do you have any opinions about what the dangers or the ramifications of an unresolved torticollis can have, despite the aesthetic fixing of it? I guess you could say.
Yeah. So neurologically, it's devastating if it's really bad. So basically, the main processing center to your central nervous system is in the base of your skull, cerebellum. In the first year of life, it grows 240%. It is your mainframe. If you have a computer system anywhere, let's say in an office, there's a mainframe computer and it sends all the information to the peripherals, which would be, your handhelds or whatever the other screens. Well, your brain does the same thing, has a master controlling center in the cerebellum, and then that cerebellum processes all the information and sends it to other parts of the brain, midbrain, prefrontal cortex, all that stuff. So when you have that torticollis, if you don't deal with the underlying system, what you do is you change the way the nervous system functions. So there's a man named Alf Brigg who wrote a book called Adverse Mechanical Tension in the Central Nervous System. And he said one of the most damaging things to nerve tissue is stretching. If you get that nerve tissue to stretch, it causes immediate pathophysiological changes in the nerve and the way it transmits impulses. So for example, if you have a torticollis and you have a tightness in muscle on one side and you don't relieve the underlying issue in the dura and you just keep stretching it and stretching it, the dural tissue is connective tissue. So it has a certain amount of give, so it will stretch a certain amount of time. But if you overstretch it, you'll get tears in it, micro tears, and it'll heal with scar tissue. So now what you've created is a traumatic pattern or scar tissue in that system, and that system will never be as flexible, will never have the same optimal potential. It's just like if you keep straining an ankle, you get scar tissue, it's less stable, it doesn't have as much flexibility. So when you stretch and damage the dura, it attaches directly to the nerve. So stretching the dura, those muscles, stretches the nerve, and like as I just said, the nerve is stretched, it changes the way it transmits information. Number one. Number two, there's a baseline under your, into that lower area of the spine called, it's like an opiate derivative center. It sends input into the brain or nervous system to calm it down. There's also nerves, one of the nerves that exits right at the base here called the vagus nerve has a sympathetic and parasympathetic response. So what you can do is you can actually set up impulses. Whenever you damage a nerve, the first thing that happens is it fires more often. And just like anything else, when it fires more often, that changes the amount of input that the brain has to deal with. So it can overload the brain circuit. The other thing that happens, just like with everything else in nature, if it starts firing too much, too often, too long, it starts to break down. So in the end result, then it becomes harder for that nerve to function, it needs a higher threshold, a higher input. So you can't determine for sure, but we're what we call fault tolerant mechanisms. Our body will adapt to that, but those adaptations will become compensations and lower our adaptive threshold later on, which is why very often kids who are diagnosed with neurological issues don't get diagnosed till they're 3 or 4 years old, till the process has been set in so long that their threshold is decreased. And when they get in an environment, let's say go to school or have to learn more or use more of their brain, that's when the system breaks down. So they can deal with a certain level of environment. As you raise that bar, if the nervous system can't adapt, that's when you start to see the disease processes.
And so in terms of disease processes, do you have a few examples that you can think of?
So I'm talking about process neurological issues, I mean, anything from anywhere from on the Asperger spectrum, ADD, ADHD, or visual cortex issues, tracking issues, memory issues. So anytime that the brain, the brain's a master computer, but if you overload the computer, it has a harder time adapting. It's no different. We are different than a hard drive, but your hard drive in your computer has a certain amount of information you can take in. That foundation is laid in the first 2 years of life. So the first 2 years of life, 90% of the parts of your nervous system, what's called gray matter and white matter, so the gray matter are the neurons and the white matter are the pathways, that is developed in the first 2 years of life. So if you inhibit that development, then you decrease the ability of the body to work more. It's kind of like building a city and putting 250,000 people in it and not building the right infrastructure, and those people continue to grow and prosper, so to speak. And, when they get to 750 million people, the system breaks down. Well, the same thing can happen to your brain and your nervous system. So there's not a big, so let's take two things, sensory proprioceptive and sensory integrative disorder, let's say.
Mm-hmm.
So what those systems are is that the body's inability to adapt to outside stimulus. It can't process the information. So with sensory integrative disorder, very often what happens is they can't integrate the information. And so what they do is they shut down. So those are the kind of kids that will crawl up in a ball, get in the corner. Sensory proprioceptive, it's almost like someone's poking them all the time, and they get very anxious, and those kids act out. But it's the same stimulus. It's taking an outside stimulus, not being able to adapt to it, and that's how you react to it. So that is the kind of thing that happens. So to give you what the symptom, there was a study done even in the 90s from the Arizona Medical Neurological Institute. And they basically found that kids with trauma at the base of the brainstem affected what they call the pre-programmed proprioceptive feedback loops. And what they found is that in the initial stages, these kids would have minor symptoms. They may be a little irritable, any type of minor symptoms. But if the condition wasn't resolved, as they got older, the symptoms raised the bar. And they were unable to concentrate. They had sleep issues. They had behavior issues. And that, again, is one compensation after the other. It's basically like low-level neurological abuse that will build up if not corrected.
Right.
So yeah, I think yeah.
And I think one of the biggest concerns there too is that the child might now end up in school, and the system now maybe views the child as dysfunctional or broken in some way, or and then parents kind of take that on, and all of a sudden it feels like a hopeless situation, yet it's completely neurological.
You know what's interesting you say this. So a lot of kids that we get have OTs, let's say, and they're going through these processes because their parents and the school or whatever system noticed a weakness in their neurological system. What has happened so many times, like pretty much most of the time, if they come in for care in our office and we start to make adjustments to deal with the underlying issue, they'll come back and they'll say, boy, the OT said, or the PT said, or the doctor said, I don't know what you're doing with your kid now, but whatever happened recently, your kid has just made so many, like 6 months worth of changes that we're working on in the last 3 weeks. And what the point of that is that when you deal with the underlying system and open up that pathway, then you can reestablish normal neurological channels. If you're trying to work with neurological channels that are already damaged and hampered, the process is so much harder and so much longer. To put it simply, if you dislocate your shoulder and you don't let the ligaments that stabilize it heal and you try and exercise that shoulder, you're going to damage it more. But if you let the underlying structure heal, then you can fix the shoulder and the muscles and rehabilitate it. Well, the brain's the same way. If you don't clear the channels and the pathways, then you're going to be working so much harder. I mean, the amazing thing about the brain is that it has the ability to make new pathways. It's called neuroplasticity. Mm-hmm. So you can, but it's so much harder to create a new pathway. It's like, when is it easier to learn a language, at age 2 or at age 42?
Right.
Age 2, because you can open up. So it's the same thing with this type of situation, is that though the brain can adapt, what you want to be able to do is make sure that the underlying structures are functioning normally. And then if you need to rehabilitate it, then you have a much better shot at it, and it's a much easier path.
Wow, that's great. I guess the last thing I wanted to talk about was, do you find that when you have a child with torticollis that there are specifically other things you need to check for? Kind of like the...
Other things to look for, other anomalies, you mean?
Exactly.
I would say that anytime I find any anomaly in a child, I tend to look a little bit harder for others because they do tend to come in, pairs, triplets. So with torticollis, now I don't x-ray little kids. I don't x-ray babies. Okay. So I can't tell you that clinically I found, spina bifida or whatever particular. So no, but whenever I find a torticollis, the body reacts in I do a technique called SOT called like loved brother relationships, which means if one area of the spine compensates, another area will adapt to that compensation. So very often, if I find a child that has torticollis, very often I'll find that there's a torsion in the pelvis as well, that the sacrum or something has compensated for that. I'll also then find something in the cranium. Again, think of this as I wish I had I don't know why I wasn't prepared. I should be. Well, here we go. I'll just take a plug here. All right. I think I'll take a plug. Hang on. There we go. All right. So we have a dural system, right? It comes up and attaches. So if I take, this way we can get in the screen here. If I take this tube and I torque it at the bottom, I put a torque in at the bottom, as you see, it's going to twist in other areas of the spine. Those are going to be areas of compensatory distortion. So if, let's say, this twist is at the second cervical vertebrae that we talked about and it causes a torticollis, if I'm working on this and don't look at the torque down here and don't unwind it, it's going to make this process a lot harder. So yeah, whenever we find an issue, we always check the entire dural lineage, especially in the not just in adults, of course, which we do, but in pediatric practice, it's extremely important because sometimes the focal spot of the problem, whether it be a distortion, pain, or neurological, is not where the problem is coming from. but
Right.
it's where it's ending up. So yeah, so the answer to your question is yes. We usually look for other imbalances and want to check the entire system to make sure that we've gotten not only the effect, but the cause.
Do you find that you see more tongue tie in children with torticollis?
Someone else asked me that, and I honestly have not correlated it.
Okay.
So I see a lot of tongue tie. Again, a good actually 40% of the tongue tie I see, I don't think need to be resolved,
Hmm.
because they're not functionally a problem. They're just there. But have never correlated, even though I see a lot of it, the common denominator between tongue tie and torticollis. I don't. I would say, honestly, pardon me, I see a lot more tongue tie in percentage of babies than torticollis. I can tell you that.
Right.
So in other words, if I get 10 new patients
Yes.
of babies, maybe four of them will have tongue tie and only two torticollis.
Right.
But this is just, it's not, I have never clinically tracked it, so I couldn't tell you
That's great.
that.
Wow.
Yeah.
Fantastic information. Let me see here. I think I had made myself a couple notes.
Okay.
Um,
I'm putting my
yeah.
Dura back. Hold on. There we go.
Yeah, I think we hit it all. That was so good. It makes me realize too that I need to take another one of your classes. I'm going to go to your website as soon as we hang up and
Yeah, we're going to be we're doing a whole certification series now. So it's 3-part.
okay.
Part 1 spinal, part 2 is cranial, and part 3 is clinical integration.
Great.
So if we ever get out of lockdown,
Yeah, right.
where are you? We're
In
in,
Washington State.
you're in Washington State, so you guys got hit pretty fast and hard.
Yep.
So are you able to practice and no
We're
problem?
fully, completely open. A lot of the chiropractors
Wow.
in our area chose to close. We
Yeah.
remained open. And it's been great. I think it's a great opportunity to, as safely as possible, bring some awareness
Right.
to how important it is to just be healthy through this and
Yeah,
all
really.
the
I
time,
know.
like those proactive things that we can do. I think chiropractic is such a big part of that. And so we
Absolutely.
still have lots of families coming in, and we're completely just kind of business as
Awesome.
usual with a lot of extra steps.
Yeah, that's what we've kind of slowed down we don't have people in the waiting room anymore, so they're calling up from there. So we've definitely had to slow things down to keep it, CDC safe. But you're right, we really have to look at this inside out as opposed to outside in. Everybody's waiting for something from the outside to save us, and
Exactly.
that's not really the chiropractic paradigm anyhow.
No,
But
not at all. Not at all. I think, what a great opportunity to just kind of tell the story.
right,
And I feel like the people coming in, they really understand that, and they
yeah,
are prioritizing it even more now, just
yeah.
because it seems that much more important all of a sudden.
Yeah, it's amazing. I've had a couple of people come in and say, "This is the first time I've been out, and the only place I've gone." I had one
Exactly.
woman, she just came in. She was waiting. She was a regular patient. She was very scared, very nervous, but now she's coming back in with her 2 kids, and she goes, "I've been locked down for 41 days. This is the first place I've been to." And I'm like, "Man, I don't know how you've been locked down 41 days with 2 kids." She's a single mom. I'm
I
like,
know, right? I'm so grateful to be able to go to work and have
"Oh,
things feel somewhat normal.
yeah,
Yeah. Well, thank you so much.
no
You're
problem. Well,
awesome.
thanks
That
for
was
doing
amazing.
this."
Thank you very, very much. I
Okay.
think that's going to be really helpful. I feel like there's such a need for parents there's just so much misinformation,
Yes, there is.
and it's downplayed. It seems downplayed so very much. And I'm kind of obsessed with it right now. So
Good. It's a
yeah,
good thing to be obsessed with because it is
yeah,
really important. And you're right, it is downplayed. People like, yeah, even things like helmets and stuff, their parameter is 8 millimeters of a difference. If you measure the head and there's more than 8, I'm like, that's a lot.
a lot.
That's a lot. That's a lot of distortion.
Yep.
That's like, try and walk around with one leg 8 millimeters shorter than the other. Tell me how you feel.
Exactly. And the
Yeah.
one thing you mentioned that I hadn't given any thought to was the forward head carriage piece with
Oh yeah.
helmets. It didn't even occur to me. But I think about all the babies that come in with helmets on, and sure enough, they're
Yeah. So if I have a patient who chooses to use a helmet at the same time they're coming in, then I tell them, look, I'll be happy to take care of you. I'm not here to make the decision for you, but here's the parameter. Number one, you have to bring the kid in regularly, no less than every 2 weeks, so preferably once a week. And
Mhm.
number two, you have to tell the people who are using the helmet to check the kid sooner than they would normally do because their head will change faster. So if they're saying every 6 weeks, you have to cut that at least in half. Because I've seen kids come in. moms will come in, I'll adjust him, and they'll come back the next week and say, he's got a red spot in the back of his head. It's all red. I said, because his head is growing back. It's pressing on the helmet. And I've had kids who are supposed to wear helmets for 6 to 8 months. 3 months they're off of them. I've had a lot of parents, I've seen them take the helmet off because they saw the kid change so fast. And I measure them. I have calipers in my office. So
Right.
obviously it's not as accurate as the digital measuring system. I don't have that, but I have a caliper in my office and I measure them while they're being treated, usually every 2 weeks, so we can track the changes. Because if they're not changing, they may need external help. So yeah, so those are important factors, but they need to stay regularly, mainly because of the cervical curve issue and because of the growth, the changes in how fast the head grows. So that's I think it's really important if you're going to
That's
take care of
great.
that.
Do you, when I was looking at your website, I didn't think to look for, do you have any, out of some of the books and things that
Yeah.
you've produced, do you have anything for parents specifically or for like communities at large?
The only thing that's, my other website, Wellesley Chiropractic Office, that
Yeah.
one, wellesleychiro.com. That's my
Okay.
office. There's a section on pediatrics. There are some PDFs on things like concussion, and I think there's one on flagiocephaly. So we do add stuff into that as
Okay.
much. So the website you're on, the Dr. Martin Rosen, is only professional.
Okay.
But the
Gotcha.
wellesleychiro.com, there are some things that I don't remember exactly which I put on it, but there are some PDF. There's a whole section on pediatrics in that website for people to download and look at. So yeah, so that's on that website. I don't send my patients to the Dr. Martin Rosen. Some of them have found it, obviously, but
Sure.
it's all for the profession.
For professionals. That's
Yeah.
great. Excellent. Well, thank you so much. I
All
really
right. Well,
appreciate
thank
your time.
you.
That was excellent.
All right. Great.
Thank
Well,
you.
it's
And
great
I'll take a
talking to
look
you.
and definitely come take some courses. I need to.
All right. Well, keep up the good work. It's
Thank
awesome.
you. Take
Thank you.
care. Good
Bye-bye.
luck.
Thanks.